Okay, we had some technical difficulties there, but we are rolling now. Okay, a couple changes. As you can see, some technical difficulties here. So welcome to PPM's April and March podcast. Since we were running a little bit late in March, we had to kind of move it over into April, but kicking it off early. And so we appreciate the fact that everybody's watching our podcast again, and the coffee pot's always on if anybody ever wants to stop in. So remember, hit that like button and the little bell, the subscribe button. And again, by hitting that subscribe button, you'll know second we put a podcast up, you get a notification. And also, YouTube likes the fact that when you subscribe, that's what they're looking at. So the more subscribers we get, the better it is for us to be able to come to you with the podcast. So again, please hit that subscribe button. Tell your friends and family to watch our video. Doesn't have to be just our instructors. Okay, first thing we're going to talk about is we're starting to get a lot of students calling to refresh their cards. Tis the season, so to speak. And one of the things they're saying to us is that just send them out their new card. And we say, well, no, there's a class you have to take in order to get your new card. That's a refresher class. And they'll say, no, I don't have to do that. Last time I just sent my old card in with a check and I got my new card in the mail. Well, yeah, that's fraud. You can't do that. Okay, we've heard that several times. And not necessarily just one instructor. So there are a couple instructors that are just mailing cards, sending cards. They're not doing classes. And that is 100% fraud. Not only will the instructor get decertified, but if you take a course with them, not your card will be decertified, your CPR card. And it's a very good possibility if you're a nurse, you could lose your nursing license because that's 100% fraud. If you're going to commit fraud on something like a CPR class, then you're going to commit fraud on your patient and your meds and things like that. So that's how it's looked at. Do not do that. That is fraud 100%. And don't risk all your training and education, your career over something like a CPR class. Okay, please don't do it. Next question we get asked is, when do I get decertified? Well, American Heart Association says you have to teach at least 2 classes a year. If you don't teach 2 classes a year, say if your card ended in May, then the June 1, you're automatically decertified. We have to go in and decertify you, which then means you have to go through a recertification process. It's just a lot of paperwork, a lot of headaches. Bottom line is, don't let that happen. Pay attention to when you're expiring. We notify you well in advance that you're coming up on expiration. If you need to get monitors done, if a class is done, whatever. So yeah, don't let that happen. That's a real mess. Next thing is a little quick story here in reference to PTSD. You know, years ago, we had a class that we taught, and the students actually had to save. So we didn't realize it when we started the class at the school that they had actually done CPR on one of their instructors, one of their teachers, used an AED and actually saved her right there on the spot. As we were playing the video for the class, one of the students had gotten up, walked out of the class, and then passed out. Syncopal episode. And I relayed that to the principal of the school, the fact that when you see something like that happen, usually that's a flashback to them seeing something like a real CPR take place. Nothing was ever mentioned to us that this had actually happened literally 2 months prior to us coming there. So we continued teaching the class. The person that was in the cardiac arrest came up to me and said, Joe, just to let you know, I was on that floor about 2 months ago in cardiac arrest, and they saved me with CPR and an AED. So there I am talking to the person that was actually saved. She was very thankful for the fellow instructors around her that actually did CPR and saved her. But the girl that actually used the AED on her literally was beginning to suffer from PTSD. She was having flashbacks. She was going through stress issues, all kind of things. And that was a successful save on the patient. But just the entire nature of the entire cardiac arrest that she worked on this person really came back to haunt her. And so Heart Association published a letter on 3/21/22 of this year talking about the lay rescue or first responder when they get there, the psychological effects of a CPR. And that's something you really need to bring up to your students. The fact that you do CPR, those of us that have done this many times, know that not every person gets up, thanks you, shakes your hands, and walks away. That's kind of rare. So you want to get through to your student that the fact that they're doing this, they're doing everything they can for that patient, but that the odds are that they're not going to jump back up again. And so kind of prepare them for the fact that they're going to think that they did something wrong. That maybe if they did compressions better, maybe if they did ventilations better, they would have saved the patient. And we know that that's not necessarily true. And so make yourself, available to them. Talk to them about that. See if anybody's ever had an issue like that. And this is our chance to begin to defuse that scenario. Okay, again, we're always available here. If you want to route a student back to me, have them contact our training center, and I'll be happy to talk with them in reference to CPR and how that all works and what they're going through. Okay, because everybody does, especially the new folks, that this is their first cardiac arrest that they've worked. Okay, next item on the agenda is instructor's name on the card. We're finding, occasionally when a person calls in and wants to renew their class, one of the first questions we ask them is, well, who was your instructor? So that we can route that student back to you so you can teach them again. And in this case, it was a female that was the instructor for that person. That was the name on the card that we were given. But the student told us it was a male that taught the class. And we said, well, was the female instructor there? And the answer was no. She wasn't anywhere to be seen. So another person taught the class, but his name was not on the list, our list, and certainly was not anywhere, should not have been on our card that was issued to that student. So again, if you're the instructor of record, you need to be there to teach that class. If somebody else is teaching the class and you're currently in that class the entire time, you're monitoring the class, you're going through it, then your name can be on the card. You were present during that entire thing, and you were the one authorizing that card. But if you're not there at all, do not have your name on that card. Again, that gets back to fraud that we talked about earlier. So do not do that. Okay. My next little thing is kudos to the Towson State University Police Department. They just had a successful save on campus. Pretty cool. And it wasn't by the instructors. It was by their fellow officers that they had taught CPR to and how to recognize a person going down, what to do, step 1, step 2, step 3. They did everything and a successful save. Special thanks to Sergeant Samuel Hannigan for relaying that information to us, and we always like to hear those success stories coming into us. Good bunch out there. Okay, membership dues. We get questions all the time about when did dues start? Well, actually, 2019 we kicked off dues for PPM for our instructors. And the reason we did that is everybody thinks we make $1 billion off of cards. We don't. We make a couple dollars off the cards that you issue. In such that it really isn't enough with the cost of rent going up, electric, everything else, to even keep PPM viable where we're at in the current location. So we ended up having to charge dues so we can keep our operation going so that we can serve you with all the things we do for you. Okay, like all the monitors and stuff like that. We pay for all that for that being done by our training center faculty. So all that money coming in goes back out again to run the program. Okay, you don't see me driving some Maserati around the street. That's not what this is all about. It's about saving lives. The next thing comes in is reference to the ASHE monitor dues or renewal dues that literally just went out. And what happened was ASHE came out with a notification to us saying everybody has to go through their update, which is odd because they follow AHA guidelines and everybody had gone through the AHA guideline, which was free to do for the instructors, but ASHE was going to charge $35 per instructor to take this. And so we got on the horn and complained to them and said, wait a minute, this update that you're doing is mostly a thing about ASHE, not really anything new in reference to the CPR or first aid. And so they said, okay, they'll charge us half. So that's where you see the $17.50 come from. Originally that was $35. We knocked it down to $17.50, and that money does not come to us. When it comes to us, we turn right around and we have to send that into ASHE to renew your fee for your prescription or subscription rather to ASHE. Okay, so again, we're not making, that's not our money. E-card orders. You know, we've been doing e-cards since they first came out, which was pretty cool. And at that point in time, we set the standard that Monday through Friday from 10 o'clock to 2 o'clock, so 10 a.m. to 2 p.m., we will send out e-cards. And we tell everybody to have some e-cards in your stock just don't order them like 30 seconds before your class. Because we've had issues where American Heart Association's gone down, their website's gone down, and we can't even order the cards. So those things happen. But 10 to 2 is when we operate Monday through Friday to give cards. So do not call on a Saturday when we looked up and found that you placed your order Friday night at like 6 or 8 o'clock at night, and then Friday you're demanding your cards be sent. Well, no. If you order that late, they'll come out Monday morning, and it's not our fault that you did not order your cards in a timely manner for your class. But number 2 of that is don't give the person on the phone a hard time because you messed up and didn't order your cards on time. Okay, that's really not fair to that person answering your phone. She is not capable of issuing cards like that. And really, we're not going to handle somebody acting really goofbally on the telephone to our person trying to help them. Okay, so don't do that again. Otherwise, you'll be looking for another training center to be with. Okay, we're a friendly group here, but there's no reason for you to be nasty to somebody on the telephone. We're certainly not nasty to you on the telephone. So, with that said, my next little thing on the agenda here is Miss Kiana, sitting to my left here. We'll be talking about the child mannequin. Remember, last podcast we did was all about the infant mannequin and how to do that, what we're looking for when we're doing monitors, so that when you're doing your class, maybe with the video, maybe without the video, when you're doing your class, you're going to see what we're looking for that we're grading you on and what it is all about. So you would think that if you followed the video, really nothing can go wrong. Except, believe it or not, we've actually had some people where the video will show do this, and they do something totally bizarre and different. And it's got us all scratching our heads like, wait a minute, that's not what the video just said. So again, using the video can kind of keep you straight, but not a 100% requirement. But then you need to do it correctly, or you'll be gigged for not doing it correctly. Okay, all of our instructors are monitored on a regular basis. Okay, with that said, I turn it over to Miss Key.
Hello, everyone. So I like to call my mannequin for my child Shorty. And I like to start off with the choking child. Again, everything that I share today is what we should see in your monitor. You don't have to do it the way I do it. However, this gives you an idea of how to present it to your students, as well as cover some of the things that's on the exam. So somewhat, I noticed that in some of the monitors that I actually watch, where they'll have the child mannequin, but because it's so similar to the adult, they just skip over our little guy here. So with that said, I'm going to start off with an example of how I present my choking. We're going to say Shorty is giving me the universal sign that he's choking. I ask him, are you choking? Can I help? Of course I can help. Now normally I would get down to come down to that child's level and demonstrate that so that my students just could see that I have to come down to the child's level. So you've already covered that. I'll find his belly button, make a fist, thumb side slightly above, to perform that abdominal thrust, trying to create that artificial cough to get the object to come out. If it comes out, great, but if it doesn't and he becomes unconscious, I'll lower him down to the floor, point to someone and tell him to dial 911, find an AED, and come back. With that said, I start going over other things that it's on the test. I talk about knowing your limitations. If I cannot perform chest compressions with one hand, I explain that it is okay to use 2 hands on a child. The depth is still the same, 2 inches, 1/3 the chest depth. The rate is still the same, 100 to 120. So you can tap into talking about knowing your limitations. Also, in the center of the child's chest with my dominant hand, keeping my arm straight, I'll compress at a rate of 100 to 120 compressions per minute. After my 30 chest compressions, I'll perform that head tilt chin up. Look in the mouth to see if I see an object. If seen, remove it. If not, do not perform a blind sweep. I give them an example of what could happen. So I looked in the mouth to see if I see an object. I don't see anything. I'll pinch his nose, attempt to ventilate. That breath did not go in. I'll reposition the head and try again. That breath didn't go in. Immediately, I'm going back into my chest compressions. After each 30 chest compressions, I'll head tilt chin up, look in the mouth again. I don't see anything, or you can say that you do see something. You remove it, attempt to ventilate. The child is still unresponsive. I explained that you still have to go back into those 30 chest compressions, and each time before ventilating, you must still look in the mouth to see if you see an object. You might not have gotten everything. So with that said, all choking has been covered for the child. Next, I'm going to move on to a one-person rescue child. At this point, I create a scenario like I like to do, and my scenario is as follows. Shorty is playing out in the field with friends. You notice that he goes down but does not get back up. This is when I introduce scene safety. So I make sure the scene is safe before approaching my shorty. I do that patient assessment. Are you okay? Are you okay? Checking that carotid pulse, 5 no more than 10 seconds. He has no pulse. Immediately again, point, tell someone to dial 911, find the AED, and come back. At this point, I always talk about different things that could happen and transpire. Explaining in an urban setting, it takes about 20 minutes for EMS to arrive. So if you're by yourself, or if you have someone there that's not able to help you, after 5 cycles, 2 minutes of CPR, you don't have anyone to switch with, you have 4 reasons you can stop. The first one is you're so exhausted you can't go on any longer. The second one is the scene becomes unsafe. You need to get out. The third one is your patient comes to, so of course you would stop. And the fourth one is first responders have come to relieve you. So that's an opportunity to drive that point home. Also, you could also talk about the fact that if a child looks like an adult, you're going to treat them like an adult. For females, they're forming breasts. For young men, they may be getting facial hair and armpit hair. So that's when you can share that information as well. Keep in mind, you want to demonstrate what you want your students to do. We have it where you just have the students come up, but you're not telling them what they need to perform or do for you. So I just give them an example, make sure I gave them their scenario, tell them that they need to make sure the scene is safe before approaching the patient. Make sure that they do that patient assessment, tap and shout at the shoulders. I find that students will tap everywhere else but where they should be tapping. Also, checking that carotid pulse from their side. Remind folks not to reach over, okay? So with that said, you demonstrate what you need to see. Also, before even getting to that point, that's when you drive home where they need to get some help. You're in the classroom, so have them point to you and tell you to dial 911 and find an AED. So that's going over the one-person rescue child. I have them demonstrate, and once we're finished, we move on to a 2-person rescue. With the 2-person rescue, we all know the count changes from 30 to 2 to 15 and 2. And that's when we talk about team dynamics, where clear roles and responsibilities are important. Driving at home, again, that's something that's on the exam. They know that you only can have one leader, and already you went over another question that they should be able to answer once they do the exam. As well as explaining to them the bag valve mask has increased in size. So having your different size bag valve mask that you're required to have, they could actually see that the changes are here and they are necessary. It's important to use the correct size bag valve mask given your patient. With that said, if you have any questions or you would like to see a class that we teach here at PPM, you have the option to go to the ppmcompany.com website. Choose what class you would like to look at. Call in to ask that you can actually watch it via Zoom, Skype, or anyhow, or FaceTime, and then we will actually set it up for you. I thank you for being here with us. Hope you enjoyed this demonstration of what actually should be shown in a BLS class. Thank you.